The global economy is in a state of paralysis. Businesses are closed, production has ground to a halt. In many Western countries, governments are dishing out generous aid packages to business owners, freelancers and companies in need. But in many developing and emerging economies, the corona crisis hits people with full force. As a result, UN Secretary General Antonio Guterres has urged rich countries to do more for those that are less prepared. Otherwise, he warned, we face the nightmare of the disease spreading like wildfire in developing nations with millions of deaths. The pandemic affects us all, yes, but while rich countries can cushion the economic fallout from the crisis, others like Mexico stare into an abyss.
The virus has already claimed some 200 lives in Mexico, but so far there have been no lockdown measures like in other countries. And so case numbers are rising as people continue to gather, including to protest. Here, hundreds of waiters air their grievances in front of the presidential palace. Their restaurants have closed and they've lost their jobs. If I don't have that income, I can't pay my rent, I can't pay my bills, and I can't support my daughter. From today, we can no longer survive day to day by being at home. So we're exposing ourselves to come out and congregate. We know that we're exposing ourselves to the virus and we're exposed to the contagion. Mexico's president offered encouragement in a speech on Sunday. He also announced a rescue package focused solely on supporting the poor. We will defeat the coronavirus, we'll revive the economy, and Mexico will continue to stand up and show the world its glory and its greatness. But for now, Acapulco's famed beaches remain empty. Tourists won't offer much help for the foreseeable future. And there are great concerns about another, perhaps more important economic sector, oil, where prices have fallen sharply. And Mexico isn't alone among emerging economies. The collapse of tourism and oil prices has hit nations from Russia to Brazil, India and South Africa.
And for more, I'm joined by the head of the United Nations Development Programme in New York, Achim Steiner. Achim Steiner, good to have you with us. Now, emerging economies, developing countries, they are very much exposed to this crisis, this virus crisis. Which region worries you the most in terms of the pandemic and the following economic decline?
Well, as of this morning, we know that 212 countries and territories are affected by COVID-19. So the concern of all of us, but also of the United Nations, is for all countries. But indeed, as you point out, in many parts of the world, Africa perhaps being one key region of the world, but also parts of Asia, Latin America, Central America, are areas where the virus is beginning to impact, both in terms of a crisis in the health system, but then also with the social and economic impacts. And the issue of greatest concern for all of us must be that many of these poorer countries and economies don't have the health system infrastructure to cope, first of all, with the suppression of the virus. Secondly, with also providing the kind of social safety nets that are needed in order to deal with this extraordinary impact. Our sister organization, International Labour Organization, yesterday published new numbers in terms of expected job losses. 195 million jobs lost, potentially. This is a number that is without precedent, and that is a shock to not only our economies, but our societies, to livelihoods, especially when you bear in mind that over 60% of people employed in the world are employed in the informal sector. No work means no livelihood, means no social safety net. These are the front lines of the battle in dealing with this pandemic, which is both a health crisis, it is becoming a social and economic and a developmental crisis, and it is one that requires us to work together in ways as we have never been challenged to do so before.
And I mean, the sinister scenario that you're describing here also tells us that this virus, of course, causes havoc everywhere. And even rich nations are struggling to deal with the economic fallout from the pandemic. How then can poorer countries hope to cope with it?
Well, I think the first priority must be what the WHO has told us all, which is to suppress the virus. This is the first line of defense, and much of the work of the United Nations, of the international community right now must be focused on helping countries to, first of all, be able to stabilize their health systems and to have that health systems response in place. Secondly, and these are the programs that are urgently needed, is to provide fiscal means. Governments need money right now, first of all, to respond to the health crisis, but secondly, also to an unfolding social and human and economic and development crisis. And this means having resources available with which to finance mitigation measures, cash transfer programs, being able to stabilize local parts of the economy. And as you also said, countries very often are now confronted with even the consequences of the virus somewhere else in the world. Take small island developing states. Many of them rely on tourism. Tourism has imploded. Very often that's 30, 40, 50% of the GDP of these nations. This is economic collapse.
Right. I mean, what you're describing here is really that we have to give a helping hand to each other, even though we're affected by this pandemic ourselves. And this at a time when multilateralism is weakened and people have become more egoistic. There's more nationalism around. Do you think that this has weakened our ability to give a global response to this crisis?
Well, perhaps in the first reflex, there is a tendency to look after oneself, and this is understandable, it is natural, and I think every country is confronted with unprecedented challenges right now. But this virus has taught us one thing, and that is that it is a global pandemic. We can only succeed in controlling and ultimately overcoming this pandemic by working together. There is no go-it-alone solution. And therefore, the ability of richer nations to also step up right now, first of all, through the kinds of measures that have been proposed through the International Monetary Fund, but also looking at issues of debt relief and debt cancellation in order to allow countries that are in need of help not to have to use the funds that they receive from the international community to pay off debtors. Right now, there is a need for massive investment in developing countries. It will rely on the richer part of the world, but it is also in our common interest, because even from a perspective of economic recovery, the markets into which industrialized nations will sell after this pandemic are the markets of also the developing world. So there is a common interest, an enlightened self-interest, as much as the need for solidarity right now in order to massively ramp up this support, because otherwise we will not only see the economic collapse, there are social, geopolitical consequences that I think none of us have either considered so far clearly enough and that need urgent attention.
All right. Help others to help ourselves, basically. Achim Steiner, the head of the United Nations Development Programme in New York. Thank you so much for your time. And now time for your questions. Questions you sent us on YouTube, Twitter and Facebook, or via email. And as always, our resident corona expert, DW's Derek Williams, stands ready to provide some answers.
Are fatality rates of COVID-19 related to blood types?
I'm not aware of any studies looking at fatality rates and blood groups for COVID-19, but this is a really interesting question, because with other types of viruses, blood types have been shown to affect susceptibility to infection as well as severity of outcomes, though we still don't know exactly why. A recent preliminary study carried out by Chinese researchers did indeed discover what they think are some connections between blood type and susceptibility to the new coronavirus. It says people with blood group A did indeed seem to be more likely to catch it than other groups, while blood group O appeared less likely to get it. That data is still unconfirmed, but if it's correct, it could have an impact later in clinical practice. But the differences, if they're there, are unlikely to be really major.
What risk could COVID-19 pose to pregnant women and their unborn children?
If you're pregnant or have a newborn these days, I'm sure you're probably frightened even more than the rest of us. The WHO has a question and answers page dedicated to you. Some of the key takeaways, though, are that first, there's currently no evidence that pregnant women are at higher risk of severe illness than anyone else. So the precautions they should take are simply the same as those we're all taking. We still don't know if a pregnant woman can pass the virus along to her baby during pregnancy or delivery, but the WHO also recommends prioritizing pregnant women with symptoms for testing. as they may need special care if they have the disease. And finally, it says women with COVID-19 can breastfeed if they wish to, but they should wear a mask if one is available. They should wash their hands before and after touching the baby, and also regularly disinfect surfaces in the household.
Can you protect your lungs from COVID-19 by giving up smoking?
In this pandemic, smokers are in particular danger for a couple of different reasons. First, when it comes to possibly contracting the disease, a smoker's lips regularly come into contact with their fingers, which is one of those things that you really want to avoid. And of course, regular smoking also leads at some point to lung disease and reduced lung capacity. Those are two comorbidities that can have a major impact on outcomes if you do catch COVID-19. One study of data from around 1,100 patients in China indicated that severe disease and case fatality were over 2.5 times higher for current smokers than people who had never smoked, which really shouldn't come as a surprise. So, Jacob, there's never been a better time to quit.
And a quick look to India, where millions are required to stay indoors for 3 weeks to slow the spread of the coronavirus. Among other measures, the state of Punjab installed a so-called COVID-19 safety station where workers can wash their hands and have their temperature taken before being sprayed with disinfectant. A similar initiative for people on motorbikes was started in Chennai.